Well, new COVID boosters are now available and already at some local pharmacies.
The shots, which the FDA just approved, target the latest versions of the Omicron variant.
So should you get the latest booster? UW Health Chief Quality Officer Dr. Jeff Pothof back with us after vacation.
Hi, Dr. Pothof. Good to see you.
How are you guys?
So the new shot's here. The targeted booster shot.
The bivalent booster, which is targeting BA4 and BA5, the Omicron subvariants that are in our community right now, are likely available, if not today, in the next couple days.
And who is eligible to get one?
So in a nutshell, if you're age 12 or older, and it's been more than 2 months since your last booster, you'd be eligible for this new booster that covers these subvariants.
And what if you've never had a shot?
If you've never been vaccinated, you still need to get the original 2-dose series to be vaccinated. If you've been vaccinated before, but maybe you haven't been boosted, you would be eligible for this new booster.
Do you think people should get it? What's your feeling about it?
I think so. I think there's very little downside. The data that we have on this is that antibodies that are created after this bivalent booster, this new booster, are about 8 times higher to these new subvariants than the previous vaccine. That's good enough to get it approved. There aren't safety concerns. We don't have the data that says, well, you're 90% likely to not get symptoms at all if you get this booster. But at the worst, it's going to be as good as the current vaccine, and there's a really good chance it's actually going to perform a little bit better.
A lot of people are getting COVID right now. 2 of my friends tested positive over the weekend. Is there a window you have to wait if you've had COVID?
Not specifically. I think most would say that if you've had COVID, you're probably pretty well protected, at least for probably 2 months after you've had that infection. So you won't necessarily have to run out and go get that booster, although you could. At the same time, if you've been a couple months out from a COVID infection, reinfection is something that we see. So getting a booster that would likely reduce that risk would be a good idea.
What is your current feeling about us heading into the fall, back to school? Kids are going back into dorms, not wearing masks. Do you think we're heading for a fall or winter COVID surge?
I don't know if it'll be a COVID surge. Certainly those things like schools coming back together, winter where people gather indoors, would lead me to think that cases could go up. I don't know if it'll be a surge. Right now things are looking pretty good. We'll have to see how fall goes. If we look at flu season, typically we base our flu season off of what's going on in Australia. They're having a pretty rough season right now. So I do think we could see a much more vigorous flu season than we've seen in a couple years.
And can you get your COVID booster and your flu shot at the same time?
You can. Different arms. It's not one shot. So you might walk away a little sore, but you can get it done in one appointment if that's more convenient.
Okay,
really?
That's good to know.
And so you're saying you should get this?
I think so. I think there's almost no reason not to get it, and there's probably reason to get it. I've already looked online to see if I can make my own appointment, so maybe the proof is in the pudding.
And the government is covering it again, or is?
Yeah, so far it's covered.
Do we know anything about possible side effects with this?
I think it'll be similar. So like it's not a whole new vaccine. It's a small but important tweak to the current vaccine. So I think same thing. You're probably going to have a little bit of a rough day that day after you get that shot, but a much less rough than if you come down with COVID.
And we expect a bad flu season?
I think flu season could be a little bit worse than previous years based on what's going on over in Australia.
Because last year we had practically nothing again, 2 years in a row.
I know, we got lucky 2 years in a row.
Do you think this will convince people, because the Omicron variant has been so contagious, and like you said, everybody has
it seems like it.
Either getting sick or has been sick, will convince people who were on the fence before to get vaccinated?
I mean, to be honest, I think folks who have said, I'm not getting vaccinated, period, I don't know that this gets them vaccinated. I think folks who got vaccinated but maybe kind of like shoved or put off getting their booster shot, knowing that this booster shot specifically targets the subvariant that is causing problems right now, might be enough an incentive where they'll go out and get that booster so they don't have to worry about this.
I'm going to make an appointment right now.
There you go.
Jeff, thanks. Good to see you again.
Good to see you, Dr. Pothof. Thanks so much.
Talk to you guys.